Hi everybody, my name is Dr. Joanne and I'm a general dentist.
Hi, I'm Dr. Tiffany and I am a general dentist as well. We are from Dental Designs Clinic and we are here today to bust some myths about gum disease. Bleeding gums are normal.
Bleeding gums are one of the first signs of gum disease. You can think of your gums like tissue on your hand. So if you wash your hands every time it kept bleeding, you would know that something was wrong. So if you have gum disease or gingivitis, your gums may be irritated, may be red or swollen, and they will bleed every time you brush your teeth.
Gum disease is a minor problem.
Definitely not. Gum disease is not a small infection. If left untreated, it can result in tooth loss and a super different lifestyle. Like, it can dramatically change your appearance, your breath, your ability to chew food. Apart from that, if you leave your gum disease untreated, it can actually link to other diseases like heart disease and even diabetes. So definitely not a small issue. So people who have gum disease will lose their teeth.
It's definitely possible. If plaque and bacteria accumulate on your teeth over time and it's not removed properly, it can result in a serious gum infection called periodontitis, which is where the bone and the gum that supports your teeth gets destroyed.
This can cause your teeth to become loose and fall out. It is a common disease but very preventable. So if you have early detection, really good oral hygiene and treatment at the dentist, it can help halt the disease process. Gum disease doesn't affect overall health.
Gum disease definitely affects overall health. In later stages of gum disease, bacteria that gets trapped in the pockets of your gums can actually enter your bloodstream and trigger and circulate around your body.
Definitely. Emerging research links gum disease to a lot of other health problems, including heart and lung diseases, preterm, low birth rates, stroke, and diabetes. Gum health plays a much bigger role to our overall health than a lot of people think.
My gums bleed when I floss, so I should stop flossing. Well, if you haven't flossed in a while, your gums are probably already inflamed and irritated, which is why they will bleed when you first start.
Using a lot of strength when you floss, you could also cause it to bleed. So if you floss regularly and gently, you can remove the bacteria and reduce the inflammation. And in about a week's time, you'll notice that your gums bleed less and less as you keep going with your routine.
Treatment for gum disease is painful. Yes, that's something definitely that a lot of people are concerned about.
The use of numbing gel, local anesthetics, and pain medication these days have made treatment experiences a lot more pleasant and way more comfortable. So a lot of people can go back to their normal routines by the same day or the next day. My parents don't have gum disease, so I shouldn't get gum disease. That's not true at all.
So while genetics can actually play a part in whether you have gum disease or not, a lot of gum disease is caused by your own habits.
Yeah, definitely. If you're a big smoker, or if you have diabetes, if you're going under hormonal changes in women, or you have certain illnesses like AIDS, or just simply not brushing your teeth well enough, you can definitely get gum disease.
Bad breath has nothing to do with dental health.
All of us have had bad breath at one time or another. I've had bad breath, but it's usually quite easy to get rid of with your breath mints or mouthwash or brushing,
Yeah, and a lot of people also think that bad breath is because they are heaty or if they haven't been drinking a lot of water.
Yeah, but bad breath could be like a sign of decay or gum disease, and if you have persistent bad breath, it's usually caused by all this bacteria just building up on your tongue and your teeth and gums.
Receding gums is part of aging.
That's not true. My grandma's 77 and she's got all her teeth and none of her gums are receding. So,
that's very good. I think she's taking very good care of her teeth.
Yeah, definitely.
My grandma has no more teeth left.
A lot of people think that receding gums are because of aging, but it's definitely not the case. It happens really slowly and over time, so one day you just look in the mirror and suddenly it's changed.
Yeah, because receding gums takes a very long time, so a lot of people don't actually realize it's happening and they assume it's because of aging.
So if you have bleeding gums on a regular basis and are concerned, it's best to see your dentist and get them checked out so you can keep your pearly whites for the rest of your life. I hope this video has helped debunk some of the myths around bleeding gums.
Thank you so much for watching, and if you have any questions, please look at our website. And also, we are always very happy to see you at Dental Designs Clinic.